craniosacral therapy, which Miss Gina has done for us in the past, and we're just doing it again for another friend here that has a lot of headaches. And so I'm going to do this 10-step protocol, and it's kind of like watching paint dry. Not that exciting when you're watching it on that end. You can definitely feel a lot of things, but this is just so people can get an idea of what to expect in the different hand placements for them. And so when we talk about craniosacral therapy, I'm going to just start while I'm talking. We're talking about moving like cerebral spinal fluid up and down the spinal columns in the head. So what am I feeling for? I'm feeling what you could equate to a heart kind of pulse or a breathing pulse. And just where is the rhythm of this system at? And I'm feeling for different restrictions or openings in the system. And that will tell me also where are there fascial restrictions, where are there more internal organ, in some cases, restrictions. And it's a very light touch, about the weight of a nickel, so very, very light. And that's what I'm feeling for. I'm feeling for the restrictions within the craniosacral system itself and within the fascia as well. Sometimes you can look at people and see how their clothes are pulling different ways, and you'll know that, you know, maybe one side's a little tighter than the other, and it's kind of just looking for all those fine-tuning things and seeing where that is going. So first, I'm just starting, this is where I like to start, is with the lower GI hold, and this is how I do the 10-step protocol. You'll see some people do it a different way. If someone comes in with a different issue or ailment, you might jump to different parts of the protocol. Just depends on what they're here for. And as always, everything depends on the person and their situation, what they can or cannot tolerate, and what our physical therapy goals are, right? And so this is another treatment tool that is in our toolbox. So it's just one of the things that we can pull out to help. And I have found it to be very successful with headaches specifically. So here we go. Enjoy the show. Let me know if you feel anything. Okay. If you feel any pain or if you're uncomfortable or anything there. Your stomach's pretty lit. You feel it? Yeah. And two, this is good to help bring about body awareness to the area that I'm touching as well. Some people feel nothing, some people feel everything, see colors, vibrating motion. Some people, like I said, feel absolutely nothing at all. And so that's what I'm just trying to tease out, is where are her restrictions and how can I best help her move around in a pain-free but more equal type of way, right? So that everything is moving how it should be. You're nervous. So also too, something else that I'm noticing, not necessarily related specifically to the cranial, her Sij is fairly tight as well. So that's her sacroiliac joint. All right, move right on. Up. Just hover. It's comfortable there. I'll be out of here. How's this? Goes. And again, it doesn't look like I'm doing very much because all the motions are very minute, very light touch. Also, you'll see light touch like this with lymphedema management as well. Not an aggressive type of hand motion either. The protocols for lymphedema is not at all what I'm doing right now, just to be clear on that. But as far as the touch, it's emphasis more on a light touch than a really hard grabby touch. So you might see that as well. And so when I'm touching up here, she's really, really tight, not really wanting to flow or move any direction into flexion or extension. When I'm putting my hand on somebody, it really should kind of sink into them like a marshmallow or like a really nice soft feel. And this right now is just hard as a rock. And so I'm going to stay here longer. Next, thoracic inlet. Go here. This one. And it is not the same. I don't know if you can feel it. There's like a boom, 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 boom. Instead of being equal on either side. So wait. And so stomach gurgling is totally normal. Crying happens a lot as people release stuff. Laughing, burping, everything. It's fine. Just let it go. All different releases. So next, the hyoid. There's a couple different ways to do that. You can do it this way, which can sometimes be invasive and people like it. Or, let me have you move down the hair so I don't go on your hair. Here. Coming over top this way. Seems to be a little preferred. This kind of handling here. And to me, this feels really restricted, especially on the right. And a lot of times this one will be really restricted, especially on kids that use G-tubes and don't necessarily swallow or have the ability to swallow all the time. So I do like to address that with children as well. Or anyone with TMJ issues, I will use this technique as well in addition to other manual techniques. And sometimes you'll see I combine cranial and manual and myofascial release, like the scraping techniques and stuff. They kind of will start to blend together, just depending on what the person needs. I'll just pick a tool out, kind of use it. If it's not getting what I need it to get, move on to a different tool until we're successful. Some people prefer more of the cranial techniques to more aggressive manual or myofascial scraping techniques. Especially with headaches, I have found this to be the most successful because it's just too much at that time. When they get closer to graduation or discharge, usually they can do some other releasing techniques, not so much the cranial. But definitely in the beginning when people are really lit and in a lot of pain, this is more of my go-to. And next we do the ear pull. So sometimes if the ear pull is too much, especially for kids, I'll take the hands to the outside like this, but I found that the ear pull feels pretty good, at least for the adult population. Sometimes when I do this one, I'll get the most heat release felt or tingling in my fingers with this release. Especially if the person's headache is really in the front of their head. And sometimes you'll see us too, I might jump from this one to another hold and then come back if I'm having a really hard time releasing the restrictions. I'll go somewhere else and then come back. You will also see this also performed a lot in babies that have torticollis to help with the plates of the skull as well. And two, kind of I'll throw in a TMJ, more of a manual therapy technique as well. Especially obviously if they're having jaw pain, if that's why they're coming. This is probably my personal note most favorite hold right here for the frontal lift. This is where I can usually pick up the most of what things are moving or not moving. And two, I'll try to look down the person too and see is, one hip higher, one leg longer, anything like that. One shoulder higher, lower. Are they moving around a lot? Do they need to release their pelvis? Are their arms uncomfortable? Do they keep moving their shoulders? So it's all these things we're looking at as we're doing this as well. And it's a constant ebb and flow with what I'm feeling, but then also with what I'm looking at to help the person as well. called the Dural Pull. I kind of combine it with the suboccipital trigger point release as well, because I have found that to be super helpful. And there's a different way we could do where you hold like your thumbs like that and it kind of is a drop off. I have found that one not to be as enjoyable by people, so I do it a little bit differently, where it's more of a distraction, trigger point, Dural Pull combo. And again, if that doesn't work for you, I've got, like I said, a bunch of other ideas in the bag that I can do. And that's what's really nice about all the cranial stuff or manual therapy or even myofascial release work is one thing that doesn't work for another person, we can easily change it up and modify it so it works for somebody else. And again, the protocol is just a rough thing that we follow. And we do have people that come in every month or every week just to have this done as a part of their self-care routine, as it helps to just really reset yourself, and then you can move on and address any pains or aches that you're having at that time with us so that we can resolve it for you. So you can go on to doing everything pain-free, which is the ultimate goal of whenever you leave here. Whether it's that day or if it's ending an entire episode of care. And with her, I'm literally feeling a lot of heat release on the right to the point that it's very, very hot on my fingertips. So I definitely found the point. A nice trigger point there, the suboccipitals. And what's also nice about cranial is she came in saying she has headaches, but you know, sometimes I might be like, you know what, this leg, your left leg over here, I don't know why, she's calling to me, so let me work on that a little bit. And sometimes that will, you know, help the headache or a different body part. So sometimes if we're working somewhere else, it's not because we don't hear you, it's that it's all connected. Your body is a chain, and sometimes the lower part of the chain really affects the upper part of the chain, right? And so we want to address the entire thing. And ultimately we want to work with you, working with your doctor to find out what is the origination or cause of the headache so we can eliminate it altogether. Does that feel okay? Are you seeing colors? No. Okay. Can you feel it throbbing in back? A little bit, yeah. Oh, okay. So to her it feels a little bit, to me it feels a ton. Your neck is super tight, my dear. Oh, weird. This is not a part of cranial. I just try to do a little distraction here because the back of her neck is just so tight. So when I like to end, I do try to, there's a couple other holds we can do too, but I got a really, really big release there and I really liked how that felt, so that's a good ending point for me. Sometimes we go way over, sometimes we go way under, it just depends on what the person needs that day. But I like to kind of bring it back to more of a central feeling so that it's not just ending on the head. And And then just to demo one of the other holds, but I'm not going to get into it too much because that was a really good release from you, is under the sacrum and under here. And then another one that we do is where both knees are up and we have one hand under the bum ski and we're pulling down to help with the sacrum as well. Just lay there for a second though. So when you're done, you like everyone to just lay there until their body feels like it's ready to move, because I just reset everything.